and blessed life that will change your world and change your life for the better. I have with me a health official who is Claudia, and my co-host will introduce her. Claudia, welcome to Liberty Health. Thank you for being with us. We appreciate you so much.
Thank you. Welcome, Claudia. I know that you've got expertise in eye care. I know that you've got expertise in ophthalmic health. So, we want to spend some time just talking to you about how best should people look after their eyes, generally speaking?
Foremost, for persons with especially diabetics, the best thing is to control your sugar level. And the lower your sugar level is, the less problem you have with eyes.
So what are some of the problems that people with diabetes may face in terms of their eyes? What are some of the problems that they face?
A lot of times they will have blurred vision, especially if they didn't know if they have diabetes. So one of the main things is blurred vision. One of the other problems that we do see patients come and say that they are seeing spots in their vision, and that will signify that there's a bleed. And these spots are floating around, which is actually blood in the vitreous, which is on this picture here. That's the center. On this picture, the center is where the vitreous, that's a clear fluid, is, and if blood gets into it, then it sticks to the gel, and with this it will affect the vision, and you will have the spots.
What do those spots look like? Some people see stars. Are they floaters? What do they look like?
We do call them floaters, but one of the things we have to find out is these persons are diabetic. If persons come and say, well, I'm seeing floaters, things are just not going nowhere and it's been there for a while, and my vision is less. One of the questions we ask, are you a diabetic? And if you're a diabetic, we do think that there might be a bleed, and then doctor have to see you to examine the back of the eye. And based on the extent of damage, possible laser treatment or surgery, depends on what is presented.
But I understand that sometimes one of the first symptoms for diabetics is the blurred vision.
Yeah, that's one of the symptoms of it, blurred vision. And this is all caused by the diabetes. What it does, it affects the blood vessels in the back of the eye. And the back of the eye is the retina. And this retina is a section of the eye that processes the light that enters. So light comes in through the front of the eye, which is here, goes through to the retina. The retina changes this light, this vision, things that is seen, the object that we see, it is changed into light impulses and then travel through to the optic nerve to the brain. And what diabetes does is it's called growth of membrane, and these membranes does prevent the flow in and out of blood to the back of the eye, which should nourish the back of the eye. And if this transmission, blood preventing from going in and out, it's going to cause stagnation. It's going to cause breakdown, and this is exactly what happens. And with all of this processing, person's visions are affected.
Okay, so it's important for people to keep their blood sugars low.
As low as where you can function.
Yes.
Because some persons' blood sugar levels go too low, then they are affected generally. But as low as you can manage it, it's better for you. The less side problems you will have.
So is there a number that people need to keep in mind to keep their blood sugar around about that level?
It all depends on what time of the day you're talking.
Because
with 3, 4, most persons that is fasting after waking up in the morning. During the day, 6, 7 is quite acceptable, because that is like 2 hours after eating. If your blood sugar is 6, 7, that is okay for normal functioning.
Did you hear that? Your blood sugars after eating, 2 hours after eating, should be around 6, 7. Some of us are walking around with blood sugars like rockets, just ready to take off. They're too high. So let me reinforce that again. Blood sugar is on about 6 to 7 after eating. 2 hours after eating is important.
Yes.
Okay, so here we have then a problem of floaters in the eye. The aim is to actually keep the blood sugars as within normal limits as possible.
Yes.
How the lens? A lot of people as they get older get affected by cataracts.
Sure do. One of the other problems with diabetes is that it causes deposits of the protein that is broken down with all that stasis, the blood, the
Stasis, what does that mean?
the blood that is collected and it's not flowing properly. They do break down and then they give off proteins and other deposits from the breakdown of cells. And some of these do lodge onto the lens. And it's supposed to be crystal clear, but it do lodge on, and after a while this helps with the process of developing cataract.
So what is the best advice that you would give to people with diabetes in order to protect their eyes, apart from keeping their blood sugars within a normal range?
One of the recommended things, it's not a must, it's recommended, is that you have a screening every year, especially from age 11 upwards. Every year, and that is when they will detect any problem, if there is any problem.
And do they have to pay for this screening?
In UK, no. The service is free.
Okay.
But wherever you are outside of UK, let not this deter you. Find an optician, someone to check your eyes.
It's so very, very
It is important.
Can vision be restored once it's lost? Because I know we were talking earlier about another condition, diabetic retinopathy, where they lose the
diabetic retinopathy is basically the disease that is caused from diabetes. And this, as I said, with the blood vessels being damaged, and as we see on the screen, that's the normal retina, that's the back of the eye, and this is in the center of the white bit, that's where the optic nerve is, where the nerve leaves the eye.
We are now opening the lines to our viewers that you can call in to Liberty Hour so that we can give you some information that you will find beneficial. Remember, information is necessary to make informed choice. Okay, so the lines are now open, and we welcome our viewers around the world to Liberty Hour. This is a health-based program that is designed to enable you to have relevant information. That is, if you're a diabetic, what to do to have a healthier lifestyle. If you're not a diabetic, then this is information that will enable you to stay healthy and to keep you from the surgeon's appointment desk.
Some of our viewers might be thinking, Claudia, that, well, I'm just going to wait until God heals me. There's nothing wrong with my eyes. Some people might be loathing to say, well, I've been prayed for and I go to church every week. How do you, as a professional, deal with that?
First of all, as a Christian, one of the things is faith without work is dead.
Yes.
We can have faith, but without you put something in action. God may choose to heal you, but if He doesn't, what type of quality life you would have? You need to think about that. And another verse that says, my people perish because of lack of knowledge. And one of these things, get the knowledge to know that there are people with the knowledge to help you.
Yes.
And we must make use of it. Not that they want all the money from your pocket, no, but they're there to provide a service that will help you to live a better quality life. And how many persons would like people to read the scriptures for them? Not able to read for yourself. And one of the things that we must know, that diabetes is one of the leading cause of blindness within the working population. And it can be prevented, or the damage of diabetes to the eye can be kept at a minimum. And this is one way of eating healthy, keeping your sugar level low, and with that you will have good vision.
Okay, so you're actually encouraging people to take up the advice that is given to them by their local practitioners, to eat well, to stay well, and to exercise their faith, but also to use the knowledge that is available to them.
Yes.
Okay.
And in the midst of that, still pray, still give God thanks for the situation. Because
we have a caller on the line.
Hello, caller. Hello, good night.